PT. PT. The test should be performed in a well-lit room to observe the clot formation. Equipment. 1. Water bath maintained at a temperature of 37 degrees Celsius plus or minus 0.5 degrees Celsius. 2. Stopwatches. 3. Automated pipettes, either fixed or variable volume, capable of delivering 0.1 ml and 0.2 ml accurately and precisely. Pipette tips. 4. Clean test tubes of dimensions 75 mm into 12 mm for clotting tests and test tube rack. 5. Thromboplastin or the PT reagent. 6. Control. This is the control for the liquiplastin reagent used in this demonstration. As is evident on the literature, control values are between 11 to 17 seconds and the target value is 14. 7. Patient citrated plasma specimens. Procedure. 1. Reconstitute the tissue thromboplastin according to the instructions. Ready-to-use reagents are also available in the market. Label the thromboplastin with date and initials.
This thromboplastin reagent is stable for 7 days after reconstitution or as written on the package insert.
Allow to sit for 10 to 15 minutes, then invert gently several times. Mix the reagent well prior to pipetting at every step in this procedure. 2. Take required amount of thromboplastin reagent into a 12 into 75 mm test tube and place in a 37 degrees Celsius incubator. 3. Pipette 100 microliters or 0.1 ml of control. 4. Allow at least 1 minute for the control to reach 37 degrees Celsius. 5. Pipette 200 microliters or 0.2 ml of PT reagent into the tube containing the control. Now, why do we add twice the amount of thromboplastin? The answer is, most thromboplastins come pre-mixed with CaCl2. In case CaCl2 is provided separately, follow the instructions of the manufacturer. 6. Start the stopwatch simultaneously. 7. Mix the tubes and leave in the water bath for a minimum of 7 to 8 seconds. Then, remove, wipe the exteriors, tilt back and forth gently until a visible clot is formed. As the clot forms, the mixture will gelatinize and may turn cloudy. As long as the clot is not formed, the plasma is clear and flows along the sides of the test tubes. As the clotting starts, the plasma turns turbid and the movement stops. This is why we employ the tilt tube method, as the tilting enables us to see the flow along the sides. 8. Stop the stopwatch immediately when the clot begins to form and record the time in seconds. Carry out one significant figure past the decimal point. For example, if your result is 12.23 seconds, report as 12.2 seconds. 9. In our example, the control result is 15 seconds. 10. Similarly, run the test sample. Always run each sample in duplicate whenever you run samples manually to rule out errors. For all duplicate runs, always calculate the percentage difference between the two readings. A percentage difference of more than 10 is unacceptable and that sample should be retested. The test results for the duplicate sample run are 16 seconds and 17 seconds. The average of the two readings give the final value. The normal range for PT is 10 to 13 seconds. It has to be established by each lab by MNPT. Document the results immediately. The documentation log should contain the following information: PT methodology, reagent name and lot number, ISI, MNPT and lab range values, date, name and ID of the patient, patient readings, mean and INR value. 11.
If the result is more than 30 seconds and INR is more than 2, inform it as this could be a critical value. For several therapeutic reasons of anticoagulation, INR is maintained at a high level. For example, normal INR is less than 1.2.
Expected INR in oral anticoagulant therapy for prophylaxis for recurrent DVT is 2 to 3. Expected INR in oral anticoagulant therapy for recurrent MI is between 2.5 to 3.5. Expected INR in anticoagulant therapy for heart valve replacement is user specific. Thus, relevant patient history is very important before reporting the PT.